Pentru pacienții care prezintă hemoroizi, există și soluții medicale ce nu necesită intervenție chirurgicale. Ce tip de pacienți sunt eligibili pentru aceste intervenții, când trebuie să apeleze la medic, aflăm în minutele următoare. Doamna doctor, având în vedere că marea majoritate a oamenilor evită intervențiile chirurgicale, aș vrea să-mi spuneți ce metode non-chirurgicale și moderne există pentru eliminarea hemoroizilor.
According to my 24 years experience on proctology, I saw that, and it is obvious that all of the patients and all of the surgeons are expecting the very same two things: quick recovery and no recurrence if it is possible. We are in 2024, and the most remarkable method is Doppler hemorrhoidal artery ligation, also known as THD method, with better results, quick recovery, and it is very safe with low recurrence rates.
Care este profilul pacientului eligibil pentru această procedură?
Patients are very much confused on that. Let's say you have complaints such as bleeding, difficulty on defecation, pain, and any kind of lumps in and out of the anal area. At the end of the day, don't think about the grades. Grade 1, 2, 3, 4, it's not so much important. Just stop for a while and think about it. If you think that this situation and the complaints are disturbing your quality of life, that is the time for surgery, non-invasive or invasive. You know, hemorrhoidal disease is a chronic disease, such as hypertension, diabetes. In all kinds of chronic diseases, we give medical treatment. The illness is still the same. We just slow it down. Hemorrhoidal disease is the same. Of course, we can use medical treatment, but finally, it will come again.
Cum funcționează aceste intervenții non-chirurgicale?
Doppler method is far more different from the previous methods, such as laser treatment, radiofrequency ablation, bond ligation, longer procedure, and other kinds of open surgeries. Because in those surgeries, we were dealing with unhealthy hemorrhoidal vessels and expecting healthy results. That was the problem of the world. In this method, Doppler method, we're not doing that. We do not even touch the hemorrhoidal vessels. We just cut the blood supply of these hemorrhoidal packages. We put 6 to 8 sutures above the anus for about 7.5 centimeters. And afterwards, the unhealthy packages shrink immediately.
Este necesară internarea pacientului în spital?
First of all, you have to stay at the hospital for one night. In the morning, you will be discharged with your medical treatment and our recommendation. I'm telling orally, and also I give it as a paper, as a list. I want to see my patient in the first week. After the surgery, the patient will experience pain only after defecation. And it is nearly 5 to 6 over 10 maximum, and it resolves after the medical treatment, painkillers I mean. The pain is because of the edema at the stitch site, because in the operation we find the arteries that supply those unhealthy hemorrhoidal packages. We put 6 to 8 sutures just inside the anal canal, about approximately 7.5 centimeters, and of course there is an edema there, a circular edema. So after the operation, maximum 4 or 5 days, we experience that kind of pain because the stool is coming through that line, and that causes it, but it always answers your painkillers.
Câte zile trebuie să stea în Turcia un pacient care a beneficiat de acest tip de intervenție?
You know, perianal area contains lots of pain nerves and also it's our private zone. So we need a little anesthesia for about 15 or 20 minutes, and after that we need our patient to stay at the hospital for one night. Actually, I don't prefer to give laxative before surgery because I prefer to give it afterwards. I want my patients to experience his or her first defecation at the hospital to get and understand the degree of pain and to be sure that painkillers work. Actually, 1 week is enough for that.
Care sunt complicațiile și riscurile procedurii?
As I told you before, a Doppler method is a non-invasive method so that there's no risk of infection. Of course, no bleeding. You know, we just cut the arterial blood supply. And also there's no harm to sphincter muscles.